Hi everyone, we are the Blue team for Los Barrios Unidos Community Clinic. We are very excited to be here today to present our recommendations, and we hope that you enjoy our presentation. Los Barrios Unidos Community Clinic, or LBUCC, was founded in 1972 by passionate West Dallas community members with the mission to provide accessible and quality care to underserved individuals in their neighborhood. Since then, over 4 decades later, LBUCC prides themselves on providing a variety of services to a patient population that is 76% uninsured and 93% Hispanic. The clinic has an incredibly positive impact on the community that it serves, treating over 23,000 patients a year. Over the course of this semester, we have been fortunate enough to work alongside Los Barrios Unidos Community Clinic in their OB department and meet some of their amazing patients. One of their patients in particular that we met at the clinic, Maria, said that she's been coming to the clinic for over 15 years and that she brings her children with her too, because they provide quality care and because they're close to her home, so it's convenient for her and her family. It's because of patients like Maria that we were so excited to get to see the amazing impact that LBUCC has and how they truly transform the lives of people in their community each and every day. The 2 tasks given to us by Los Barrios for their OB department, which we believe that our recommendations will help, are to reduce per patient costs of OBGYN services by 10% and to increase the percentage of OBGYN patients seen within 15 minutes of their appointment time by 50%. We believe that our recommendations are going to help Los Barrios achieve these objectives for themselves and continue to provide quality care to their community.
So where do these tasks come from? LBUCC conducted patient surveys in 2016 to figure out why patients are not returning to their clinic. Based on the results, they missed their targets on short appointment times and patient recommendation. LBUCC needs to address 3 key issues: long appointment times, inefficient use of space, and patient retention. LBUCC knows patient retention from the OBGYN to the pediatrics clinic was low. The pediatrics clinic is important to LBUCC for it produces the highest per patient revenues. By addressing all 3 key issues, this will improve patient satisfaction within the OBGYN clinic. In result, patients will bring their children to the pediatrics clinic, which ties back into LBUCC's focus on community and family. We came up with 4 recommendations: maximizing the use of space, improve clinical staff mix, increase administrative efficiency, and lastly, enhance the waiting room experience.
So our first recommendation is to maximize the use of space. The key issues we saw at LBUCC was that there were not enough patient rooms per provider, the flow of the clinic was not efficient, and the phlebotomy lab was too small and represented a potential safety hazard. Our recommendation was to create 3 new patient rooms, which will increase the amount of rooms per provider up to that ideal range of 3 to 4. And, in addition, we want to convert the unused waiting room into a phlebotomy lab. What this will do is it will free up space for those busy MAs that have to move around everywhere, and it will reduce that potential biohazard safety issue. Finally, our impact on maximizing this use of space is that there will be sufficient exam rooms per provider, which will lead to reduced wait times. The separate phlebotomy lab will reduce overcrowding and increase safety around biohazards. In terms of our financials, the creation of 3 new rooms will cost $14,000, and converting that phlebotomy lab will cost $2,000. But over the course of 1 year, if we estimate just seeing an extra 2 patients per day in the first quarter to 5 patients per day in the last quarter, we estimate that LBU can generate an additional $80,000 to cover up those costs and still come out $65,000 ahead.
Our second recommendation for Los Barrios is to improve their clinical staff mix. Currently, over 77% of the OBGYN budget is spent on personnel and fringe salaries. So therefore, if we're looking to reduce costs but still increase quality, looking at the personnel costs is a really important thing. Second, we want to address the morning rush, which providers told us is a significant problem at LBUCC in terms of having a lot more patients want to be seen in the morning hours from 8 a.m. to 12 p.m. The average morning wait time, according to the time and motion study conducted by LBUCC, is 49 minutes, and the morning delays cause further backups into the afternoon. However, we didn't want to inconvenience LBUCC patients who may have work or have to take their kids to school or have limited transportation by having them have to come in the afternoon. Therefore, we instead wanted to just increase the efficiency of morning appointments so that they can still have the appointment times that work best for their schedule. Recommendations to improve LBUCC's clinical staff mix are to reduce the number of part-time contract physicians and instead hire one full-time nurse practitioner. Because nurse practitioners make 1/3 of the salary of OBGYNs but still provide really high quality care, we believe that hiring a nurse practitioner is going to be a really cost-effective measure for the clinic while still providing really high quality care to all of the patients. Additionally, we recommend hiring one part-time nurse practitioner and 2 part-time medical assistants to specifically take over that 8 a.m. to 12 p.m. very busy morning rush to help accommodate patients and potentially lower wait times. That these recommendations are going to have a really significant impact on the clinical staff mix in the OB department. We believe that it's going to significantly reduce personnel costs without compromising quality, which overall reduces cost per patient. It's going to better accommodate the morning rush, so it's going to increase patient satisfaction, and also it's going to address the morning wait times by hopefully reducing them from an average of 49 minutes to 27 minutes, according to our data that we put into the time and motion study. This is going to increase the amount of patients seen within 15 minutes of their appointment time and help.
And as Emily said, this is one of our largest cost-saving reductions. So these numbers may not be 100% accurate for LBUCC, but they're estimates we pulled from the Dallas community about what these people make. But if we take these estimates and look at what we might save, for physicians, by reducing the number of part-time MDs, we can save around $350,000. However, we'll need to hire a full-time nurse practitioner to cover those full-time equivalents. And as Emily said earlier, we want to hire another part-time nurse practitioner to cover that morning rush. That part-time nurse practitioner will also have 2 part-time morning MAs. And all in all, this will still come out for about $100,000 in saving.
Our third recommendation for the clinic is to increase administrative efficiency. So from what our understanding is of the clinic, it's often the role of the very busy medical assistant who handles scheduling patients after their follow-up appointments and to schedule them for future sonograms, etc. And from a time and motion study that we received, it was determined that at over peak capacity, these medical assistants are working at over 80% of the time, and they're also, like I said, responsible for scheduling the follow-up appointments. And from an interview we conducted with Dr. Sandra Lozano, full-time OB at the clinic, she mentioned to us that it would be ideal to have a fully dedicated scheduling team. And so that is why train the already present front desk staff workers to handle scheduling of future referrals and other appointments. One, reduce booking conflicts, and so it was brought to our attention that there have been issues with rescheduling patients due to double bookings or scheduling a patient with a physician they're not familiar with that hasn't been the one seeing them the whole pregnancy. And we also believe that this will free up the medical assistants to offer better care. And from a time and motion study that we provided ourselves, we believe that this implementation will give them about 8% more free time to offer better service and better care to the patients.
This recommendation ultimately doesn't cost any money because it's a form of task shifting. We're working within our existing resources and freeing up those busy medical assistants to focus on patient care rather than having to do things like follow-up scheduling.
We recommend enhancing the waiting room experience in order to increase patient satisfaction. Some of the key issues that we're addressing is the lack of engaging health materials on display and the perceived waiting time. So our three recommendations is to put up educational waiting room programming, health posters, and community artwork. And this is based off of Harvard research and many other forms of research that indicate that the patient waiting room is the best place to engage with patients about their health and wellness. And if you prefer not to have community artwork or health posters on the walls. You can also implement health magazines, health brochures, anything to really engage with the patient. So some of the impacts that we expect is to decrease the perceived waiting time, and it also gives overall better experiences to the patients in order for them to come back for pediatric care later on.
So in terms of financials for this recommendation, educational programming with SMA will cost about $800, and those informational health posters will cost about $175, bringing our total cost of this recommendation to about $1,000. However, this is a very small cost to affect something that changes the waiting room experience for every single patient that walks through those doors. So if we took a look at our summary of the recommendations we had for LBU, we maximized use of space by increasing the number of patient rooms by 33% and adding that phlebotomy lab. We've also improved the clinical staff mix, which was one of our biggest cost-saving reductions, and we've also accommodated the morning rush by adding that extra part-time nurse practitioner in the mornings. We've increased the administrative efficiency to both reduce scheduling conflicts and to free up the busy MAs, who are the ones doing a lot of those patient interactions, as well as clearing out patient rooms for patient turnover. We've also enhanced the waiting room experience, which will greatly decrease the perceived wait time and gives us an opportunity to educate patients on pertinent health information. Take a look at our total recommendations for financials. Our first recommendation cost $16,000. Our second recommendation cost $100,000. Or saved us $100,000. Our third recommendation didn't cost us any money, and our fourth recommendation cost us $1,000. And with that additional revenue of extra patient visits, we come out about $160,000 ahead. Looking at what it does to our per patient cost of services, we've reduced the per patient cost of services by 10.9%, from $250 to $222.74. We've also tackled the issue of reducing patient wait time. Our biggest reductions in patient wait time recommendations were the 33% increase in patient rooms, as well as hiring that nurse practitioner in the mornings to really handle that morning rush. And we've also freed up those busy MAs. All three of these things will greatly reduce the patient wait time.
This project would not have been possible without the amazing input and help that we received from so many different people, especially the LBUCC staff and patients. We have been so fortunate this semester in their OB clinic and see the amazing impact that they have on their community each and every day. Meeting patients like Maria, who have long relied on Los Barrios for their health care, makes us realize that they don't really just improve health, they truly transform the lives of people each and every day. We genuinely believe that our recommendations are going to help Los Barrios continue their legacy of quality medical care in the West Dallas community and help them save more lives for less for many decades to come.